Lisa Broyles here with Way to Health MD, and this is my second video in the fact or fiction about creatine and protein powders. So I'm going to jump right in with creatine and address more myths about creatine. So first I want to address the populations that creatine is safe for. So is it safe for kids? There have been several studies on giving children creatinine in doses of up to 0.4 grams per kilogram per day for up to 6 months. And these studies showed that creatine actually improved the health of children with lupus, okay? And this is children who don't have kidney disease yet, but it did improve their pain and overall energy levels. Also, children with muscular dystrophy demonstrated improved grip strength and muscular performance on creatine. Also, children that have experienced traumatic brain injury recovered faster when given creatine daily for 6 months after their concussion or whatever brain injury that occurred. So the next is it safe for the elderly? So the answer is yes. Creatine is fabulous for age-related sarcopenia or muscle loss. Weightlifting is the most important thing to help prevent muscle loss or to build back muscle. So if you just take creatine, you're not going to improve your muscles. But if you take creatine and you're weightlifting appropriately, then you're going to boost the effect of your weightlifting and improve your muscle mass and improve your bone density. So you have to work out with it or it's ineffective. What about for women? Postmenopausal, perimenopausal, does it help with bone density and prevent muscle loss? Absolutely. Again, you have to work out in order for the creatine to actually boost your improvement in your muscle mass. So there is improvement in sprint performance, in agility, in how fast women can build muscle when they are taking creatine while they are doing weightlifting exercise. As women age, they lose some of their creatine kinase due to the drop in estrogen and progesterone. So perimenopausal and postmenopausal women are an especially vulnerable population that benefits from creatine supplementation. It does benefit women with bone density loss, again, if you are lifting weights with the creatine. So last, should you load creatine or should you just take the same dose all the time? So it depends on what you want. If you are an athlete that you are trying to build as much muscle as you can in a short period of time for a competition, then yes, loading is recommended. How to load? So loading dose is taking 20 grams of creatine in a day for 7 days. Now you don't want to take those 20 grams all at once or you're going to have pretty significant GI distress. So what you do is you break that up into 5-gram doses throughout the day. So 4 times during the day, you take 5 grams of creatine. That's a safe way to get the creatine in your system as fast as possible, get that muscle going as fast as possible, again, combined with your weight training, okay? Now, if you are just wanting to maintain or build muscle just long-term, for long-term health, there's no need to load your creatine. You can just take 3 to 5 grams per day. Within 30 days, your muscle mass will be at the same as someone that had loaded, okay? So it's perfectly fine to skip the loading if you just want to take 5 grams of creatine a day. I don't advise any more than 5 grams. Again, it'll upset your stomach. It doesn't cause constipation, but it can cause diarrhea, cramping. They have done multiple studies in professional athletes that did show that creatine actually improved recovery time, decreased muscle strain and injury, and decreased cramping during hot exercise. In the next video, I will talk about dosing and brands